Welcome to this presentation on Yohimbine and mood, with a focus on anxiety and panic risk. Yohimbine is often discussed as a fat loss ingredient, especially in pre-workout and thermogenic products, but the same stimulant pathway that makes it feel intense can also make it risky for certain users. Today we are going to look beyond the fat-burning hype and focus on what Yohimbine can do to the nervous system. The key question is whether the possible upside is worth the mental and cardiovascular stress it can create. We will discuss what Yohimbine is, how it may increase arousal, why anxiety-prone lifters may respond poorly, and why stimulant stacking can make the situation worse. The goal is to give a clear, practical risk assessment so viewers can make informed choices rather than chasing a supplement that may make training feel worse. Yohimbine is usually marketed as a tool for fat loss, energy, and stubborn fat. That sounds attractive to lifters who are dieting, doing cardio, or trying to lean out for a specific goal. But the same pathway that creates stimulation can also feel like nervous system overload. For some people, the sensation is not clean energy or focused drive. It can feel like restlessness, pressure in the chest, a racing heartbeat, or the beginning of a panic response. That matters because a supplement is only useful if it improves the training experience and supports consistency. If it makes you feel threatened, anxious, or out of control, it can derail the workout and make recovery worse. The key idea here is simple. A supplement that stimulates your body does not automatically help your body. Stimulation can become stress. This slide captures the central trade-off with Yohimbine. On the promise side, the marketing language focuses on more alertness, more drive, and more fat loss hype. Those claims appeal to anyone who wants to train harder or diet more effectively, but the possible cost is just as important. Yohimbine can cause restlessness, a racing heart, and panic-like symptoms. In other words, the same compound that is sold as an energy booster may make your body feel like it is under threat. For lifters, that is not a small issue. Training requires focus, control, breathing, technique, and confidence. If a supplement makes you feel unsafe or overstimulated, it may reduce performance rather than improve it. The message here is that a supplement that creates fear, agitation, or panic is not clean energy. It is a nervous system cost. Before judging Yohimbine, we need to understand what it is. Yohimbine is an alkaloid found in Yohimbe bark. However, the labels on supplements can blur the distinction between Yohimbine, Yohimbe bark extract, and synthetic Yohimbine hydrochloride. That distinction matters because Yohimbe bark extract may contain many alkaloids, not just Yohimbine. Those other compounds may also be biologically active and can change the way the product feels. Synthetic Yohimbine hydrochloride is a more defined compound, while a vague herbal extract may be less predictable. For users, this affects stimulant exposure. If the label does not clearly disclose the type and amount, it becomes difficult to know what you are actually taking. The first safety lesson is that ingredient naming matters. A product can sound natural and simple, while still creating unpredictable stimulant effects. Label language is one of the biggest problems with Yohimbine products. A bottle may say Yohimbine bark, Yohimbe extract, Yohimbine, or Yohimbine hydrochloride, and those terms do not always mean the same thing. Bark products may contain other active alkaloids or stimulant-like compounds that are not clearly explained on the front of the label. Some products also fail to disclose the exact amount of active Yohimbine. When that happens, the user cannot control the dose or estimate the risk accurately. Natural does not mean predictable, and it definitely does not mean low risk. If a supplement hides the amount or uses vague extract language, the safest assumption is that you do not know your true exposure. For a compound that may increase anxiety, heart rate, and blood pressure, that uncertainty is a serious issue. Yohimbine is marketed because it sits at the intersection of several profitable supplement categories. It is sold for fat loss, energy, sexual wellness, and pre-workout stimulation. The fat loss claim is especially powerful because people want help with stubborn body fat. The energy claim is also easy to sell because Yohimbine can feel intense, but intensity is not proof of effectiveness. A strong stimulant sensation can be mistaken for a product working, even when the actual evidence for fat loss or performance is weak. In many cases, marketing turns fight-or-flight physiology into a fat-burning promise. That is a problem because the sensation of stress, arousal, and restlessness can feel dramatic while providing little real benefit. The goal is to separate what feels powerful from what actually produces meaningful results. The main mechanism behind Yohimbine's effects involves the adrenergic system. Yohimbine is commonly described as an alpha-2 adrenergic receptor antagonist. In simple terms, it blocks receptors that normally help regulate norepinephrine release. When those receptors are blocked, norepinephrine signaling can increase. Norepinephrine is involved in alertness, arousal, and the fight or flight response. This is why Yohimbine may feel stimulating. For some users, that stimulation feels like drive and energy. For others, especially people who are sensitive to anxiety, the same pathway can feel like nervousness, panic, or a racing mind. This is the key point. The mechanism does not only explain the fat loss theory, it also explains the anxiety risk. The pathway that sounds useful for fat mobilization can also push the nervous system toward overactivation. Fight or flight physiology can feel productive in the right context, but overwhelming in the wrong one. A moderate increase in arousal may help someone feel alert, driven, and ready to train. That is the desired outcome many users are chasing, but the bad response can include racing thoughts, tremors, and palpitations. These sensations are not just uncomfortable, they can interfere with breathing, technique, focus, and confidence. If you are squatting heavy, doing intervals, or trying to maintain controlled pacing, feeling shaky and panicked is counterproductive. This slide shows that the same physiological pathway can create two very different experiences. Some users interpret the stimulation as useful energy, others experience it as threat. That difference is why individual response is so important with Yohimbine. Sympathetic nervous system activation is not automatically performance enhancing. The sympathetic nervous system prepares the body for action, but too much activation can feel unpleasant and disruptive. With Yohimbine, users may experience restlessness, body tension, tremors, sweating, and a feeling of being on edge. Heart rate and blood pressure may increase. For sensitive users, the energy does not feel clean or focused. It can feel like panic. This is especially relevant for lifters and athletes who already consume caffeine or train under stress. A supplement that makes your body feel unsettled may reduce training quality. It can also create a negative feedback loop where physical symptoms such as trembling or palpitations make the user more anxious. The key point is that stimulation is not the same as readiness. Yohimbine may trigger anxiety because norepinephrine helps prepare the body for a threat. When nervous system arousal rises, the body can produce sensations such as increased heart rate, tension, sweating, and tremors. Anxiety-prone users may interpret those body signals as danger. Once that interpretation happens, the brain may intensify the stress response, which can make palpitations and tremors feel even worse. This can create a panic loop. The user takes a supplement for fat loss or energy, notices physical stimulation, worries that something is wrong, and then becomes more activated. That is the opposite of a calm, focused workout. This is why Yohimbine is especially risky for people with anxiety sensitivity. The supplement does not only affect metabolism, it affects the way the body feels from the inside. Anxiety and restlessness are among the most important adverse effects to understand. Yohimbine may cause nervousness, agitation, sweating, tremors, racing thoughts, insomnia, and difficulty settling down. These are not minor inconveniences if they happen during training or before sleep. A lifter who feels agitated may rush through sets, lose technical focus, or cut the session short. Someone who cannot sleep after taking a stimulant may recover poorly and train worse the next day. It is also important to avoid dismissing these symptoms as a normal stim buzz. A little energy is one thing. Feeling panicky, wired, or unable to calm down is a red flag. If a supplement repeatedly produces those effects, the risk to consistency and well-being may outweigh any theoretical fat loss benefit. Palpitations are a powerful trigger for anxiety because the heartbeat is one of the body signals people notice most. If Yohimbine makes the heart feel like it is racing, pounding, or skipping, the brain may interpret that as evidence something is wrong. That fear can increase sympathetic activation even more, causing the heart to race further. This creates a loop: stimulant effect, fear response, more stimulation, more fear. For some users, that loop can escalate into panic-like symptoms. In a workout setting, this can completely derail performance. Instead of focusing on the exercise, the person becomes focused on whether their body is safe. That is why heart rate symptoms are not just cardiovascular concerns. They can also become psychological triggers that amplify the bad experience. Older clinical research helps explain why some people may be uniquely vulnerable to Yohimbine. In controlled settings, Yohimbine increased anxiety, nervousness, palpitations, restlessness, and tremors. The response was stronger in patients with panic anxiety compared with healthy controls. Anxiety responses also appeared to track with changes in norepinephrine-related markers. The practical takeaway is that baseline anxiety matters. A dose that feels unpleasant but tolerable for one person could feel overwhelming for someone prone to panic. This research is important because it shows that Yohimbine's anxiety risk is not just anecdotal. It has a plausible biological basis. and has been observed in human subjects. For supplement users, this means self-awareness is crucial. If you already struggle with panic, high stress sensitivity, or anxiety symptoms, Yohimbine is a poor fit. The same dose does not create the same experience for everyone. Several factors shape how someone responds to Yohimbine: baseline anxiety, current stress load, sleep debt, stimulant tolerance, cardiovascular sensitivity, and medication use. Someone who is well rested, low stress, and stimulant tolerant may feel a very different effect than someone who is sleep deprived, dieting hard, anxious, or already overloaded with caffeine. Panic disorder, PTSD, or high stress sensitivity can increase risk even further. The label cannot predict your nervous system response. It can tell you what the product claims to contain, assuming it is accurate, but it cannot tell you whether your body will interpret the stimulation as useful energy or danger. With Yohimbine, individual response is not a side note. It is the whole story. Mood symptoms and heart symptoms often overlap because the nervous system and cardiovascular system are linked. Yohimbine can increase heart rate and blood pressure, and these changes may feel similar to anxiety symptoms. Some safety summaries link Yohimbine to blood pressure problems, arrhythmia, heart attacks, and seizures. Those outcomes are not guaranteed for every user, but they are serious enough to matter. High doses and stimulant stacking raise concern further. It is not accurate to treat Yohimbine as simply strong caffeine. It has its own pharmacology and can feel different, especially when combined with other stimulants. If someone already has high blood pressure, heart rhythm concerns, or anxiety-related palpitations, the cardiovascular context becomes even more important. The risk is not only mental, it can also be physical. The risk profile changes dramatically when Yohimbine is stacked with other stimulants. Combining Yohimbine with caffeine, riboflavin, synephrine, or ephedrine can increase heart rate and cardiovascular strain. Many fat burners and pre-workouts use multiple stimulants because the formula feels more intense. But intensity is not the same as efficacy. Multi-stim products may also hide the true dose in proprietary blends, which makes it impossible to know the total stimulant load. That is especially concerning with Yohimbine, because even small differences in dose can change the experience. More intense does not mean more effective. It often means more risk. If a product combines Yohimbine with several other stimulants, it should not be treated as beginner-friendly or low risk. This slide separates the mechanism from the outcome. Yohimbine has a plausible fat loss mechanism because it may increase norepinephrine signaling and lipolysis. However, evidence is not sufficient to say that Yohimbine or Yohimbine supplements reliably improve athletic performance or produce meaningful weight loss for most users. Feeling stimulated does not mean fat loss is happening. Feeling anxious does not mean the supplement is working. This distinction is especially important because many users interpret intensity as proof. A racing heart, body heat, sweating, and restlessness can make a product feel powerful, but those sensations do not automatically translate into body composition changes. Evidence-based supplementation should be judged by outcomes, not by how aggressive the stimulant feels. A bad nervous system response can ruin a workout. Anxiety can reduce focus and coordination, which matters for both strength training and cardio. Palpitations can make effort feel dangerous, even when the workout itself is manageable. Restlessness can make pacing, breathing, and technique worse. If a supplement causes those effects, it is not functioning as an ergogenic aid for that person. It may be doing the opposite. The purpose of a pre-workout ingredient should be to support training quality. If it makes you feel distracted, threatened, shaky, or unable to settle into your session, then the risk to performance is obvious. A supplement should make the training process more productive, not more chaotic. Mood and perceived safety matter because they influence how well you can train. For many lifters, the downside of Yohimbine is clearer than the upside. The potential upside includes a plausible lipolysis pathway, a stimulant feeling, and marketing appeal around fat loss. The known concerns include anxiety and panic-like symptoms, heart rate and blood pressure strain, and weak real-world fat loss evidence. This comparison is important because the side effects are more established than the fat loss benefit. In other words, we know Yohimbine can make some people anxious, restless, or cardiovascularly stressed. We do not have strong evidence that it reliably improves fat loss for most users. When the risk is clearer than the reward, caution is the rational approach. This is especially true for lifters who can make better progress through calorie control, protein, training consistency, steps, and sleep. Label uncertainty makes the anxiety risk harder to manage. Yohimbe bark extract may not equal standardized Yohimbine. Products can contain variable amounts of Yohimbine and other active compounds. Proprietary blends may hide exact exposure. If you cannot verify the actual dose, you cannot predict the nervous system response. That matters because yohimbine is not a mild ingredient for everyone. An unexpectedly high dose or a product that includes additional stimulants can turn a normal training day into a panic-inducing experience. This is why transparency matters. If the label hides the dose, it hides the risk. For a compound linked with anxiety, palpitations, and blood pressure concerns, hidden dose information should be treated as a serious red flag. This slide identifies the high caution groups who should avoid yohimbine. People with anxiety, panic disorder, PTSD, or high stress sensitivity are at higher risk for a negative nervous system response. Those with high blood pressure, rhythm issues, or cardiovascular disease should avoid it due to heart rate and blood pressure concerns. Pregnant or breastfeeding individuals, stimulant-sensitive users, and people taking antidepressants, stimulants, blood pressure medications, or interacting drugs should also avoid it unless medically cleared. Supplement safety guidance specifically advises people with anxiety, depression, hypertension, hypotension, or PTSD to avoid yohimbine. The practical message is simple. If you already have a condition that makes sympathetic activation risky, yohimbine is not the place to experiment. The potential upside is not strong enough to justify the risk. This slide reinforces that the content is educational and not medical advice. Yohimbine is not appropriate for everyone. It should not be stacked with high stimulant, pre-workouts, or fat burners. If anxiety, panic, PTSD, hypertension, heart concerns, pregnancy, medication use, or stimulant sensitivity apply to you, yohimbine should be avoided unless a qualified healthcare professional clears it. When risk is meaningful, safety has to come first. This matters because many supplement users treat ingredients as casual experiments, but the yohimbine can produce strong nervous system and cardiovascular effects. If you experience panic, palpitations, unusual blood pressure symptoms, severe restlessness, or other concerning reactions, stop using it and seek appropriate care. A supplement is optional. Your health is not. Do not use anxiety as proof that a supplement is working. A racing heart or restless mind does not prove fat loss. A safer fat loss framework prioritizes calorie deficit, protein intake, daily steps, resistance training, sleep, and consistency. These factors create the majority of body composition progress without gambling on a high-risk stimulant. Hidden dose thermogenic blends should be skipped because they make risk impossible to estimate. If mood symptoms, panic sensations, or heart rate issues appear, that is a clear sign that the risk-to-reward ratio is poor. The best fat loss plan is one you can recover from. If a stimulant harms sleep, increases anxiety, or makes training feel unsafe, it undermines the consistency needed for long-term results. This slide applies an anti-hype filter to common yohimbine claims. Myth: natural means safe. Fact: natural extracts can be potent, variable, and unpredictable. Myth: anxiety means it is working. Fact: anxiety is a side effect, not proof of fat burning. Myth: more stimulation means more fat loss. Fact: fat loss still depends on fundamentals like calorie balance, protein, training, and sleep. Myth: stacking makes it better. Fact: stacking increases risk and uncertainty, especially when the total stimulant dose is unclear. These myths are common because stimulant intensity is easy to market. The truth is less exciting but more useful. If the ingredient creates more stress than results, it is not a smart tool for most lifters. Here we organize the evidence into practical tiers. The mechanistic tier refers to the alpha-2 receptor and norepinephrine pathway. This mechanism is plausible, but it does not prove long-term fat loss. The supported risk tier includes anxiety, restlessness, and palpitations, which are well-recognized concerns. The high caution tier applies to panic-prone users and people with blood pressure or heart rate risk. The limited tier applies to fat loss and performance evidence, which is not strong enough to justify broad recommendations. The label risk tier covers variable extracts and hidden blends. This tiered view makes the overall picture clear. The mechanism may be interesting, but the risks are more concrete than the benefits for many lifters. Yohimbine's mechanism is plausible, but risk matters. Increasing norepinephrine signaling may sound useful for fat loss on paper. It fits the marketing story. More norepinephrine, more lipolysis, more fat mobilization, but the same pathway can push the body toward fight or flight. That means anxiety, tremors, palpitations, and a feeling that the nervous system is under threat. A plausible mechanism is not enough to ignore panic and heart rate risk. This is the key scientific balance. We cannot judge a supplement by mechanism alone. We have to ask whether it improves real outcomes and whether the cost of using it is acceptable. With Yohimbine, the risk side of the equation is too meaningful to dismiss. Anxiety-prone lifters should be especially cautious. Yohimbine can cause nervousness, restlessness, palpitations, and tremors. Panic-prone individuals may respond more strongly than healthy controls. A bad nervous system response can ruin not only the session, but also the rest of the day and the recovery process afterward. This makes Yohimbine a poor fit for beginners, people with anxiety sensitivity, and anyone already under high stress. The supplement is not beginner-friendly, and it is not ideal for those who want calm, controlled training. If the goal is better body composition, there are safer and more reliable strategies. The mood risk alone is enough to make many lifters skip it. The bottom line is straightforward. If a supplement makes your nervous system feel under attack, the possible fat loss upside probably is not worth it. For most lifters, the basics beat stimulant gambling. A calorie deficit drives fat loss. Protein supports muscle retention. Steps increase energy expenditure. Lifting protects strength and muscle. Sleep supports hormones, recovery, and decision-making. Consistency ties everything together. Yohimbine may sound exciting because it feels intense and has a plausible mechanism, but intensity is not the same as results. If the cause is anxiety, palpitations, insomnia, or panic-like symptoms, then the supplement is working against the bigger goal of sustainable progress. This slide summarizes the full message in a quick question and answer format. Can Yohimbine feel intense? Yes, sympathetic activation can feel powerful. Does that prove fat loss? No, the evidence for real-world fat loss remains limited and inconsistent. Who should avoid it? People with anxiety, panic disorder, PTSD, blood pressure or heart concerns, pregnancy or interacting medications should avoid it unless medically cleared. What is the bottom line? For many lifters, the risk is clearer than the reward. This summary is useful because it cuts through the hype. It reminds viewers that the decision should not be based on how strong the supplement feels. It should be based on whether the evidence and safety profile justify use.